Bismillahirrahmanirrahim. Today lecture is about identifying common cardiac arrhythmias on ECG. Identifying irregular heartbeat on ECG graph. Any arrhythmia or irregular heartbeat is a problem with the heart or rhythm of heart. Heart may beat too quickly, too slowly, or with an irregular rhythm. It is normal for heart rate to speed up during physical activity and to slow down while resting or sleeping. It is also normal to feel as if heart skip a beat occasionally. But a frequent irregular rhythm may mean that the heart is not pumping enough blood to body, may cause dizziness, panting, or have other symptoms. Type of arrhythmias. In general, heart arrhythmias are grouped by the speed of the heart rate. For example, tachycardia is a fast heartbeat. The heart rate is greater than 100 beats a minute. Here in this graph, we know the formula to calculate the heart rate. We divided 300 by the number of big squares between the two RR waves. In this graph, you can see that there are 3 big squares between the RR interval. So this comes under normal heartbeat. When we divided 300 by 3, we get 100 beats per minute. This comes under normal heartbeat. We know that normal heartbeat is 90 to 100 beats per minute. Bradycardia, slow heartbeat. Slow heartbeat is called bradycardia. Bradycardia is slower than normal heart rate. A normal adult resting heart rate is between 60 to 100 beats per minute. A heart rate below 60 beats a minute is considered bradycardia, but a low resting heart rate doesn't always mean there is a problem. In physical fit, heart may be able to pump enough blood to the body with less than 60 beats a minute. Slow heart rate and insufficient pumping blood is considered a type of bradycardia. Bradycardia on electrocardiogram. How we can calculate bradycardia on electrocardiogram. Here are 2 R waves, and between, if we will count the big square between these 2 R waves, they come 1, 2, 3 and 4. If we will divide 300 by 4, it will come 75 beats per minute. But in this case, there are 1, 2, 3, 4, 5, 6 and 7 big square between the RR interval or RR wave. If we will divide 300 by 7, we will get 42 beats per minute, which come under bradycardia. Type of tachycardia include sinus tachycardia, supraventricular tachycardia, atrial fibrillation, and atrial flutter. In this lecture, I will cover these 4. Sinus tachycardia. Sinus tachycardia is sinus rhythm of the heart with an increased rate of electrical discharge from the sinoatrial node, resulting in a tachycardia, a heart rate that is higher than the upper limit of normal, which is 90 to 100 beats per minute for adult human. What we mean by sinus tachycardia, we know that the heart conductive system, which originates from the SA node through the conductive system, they arrive at the AV node, then pass through the bundle of His and left and right bundle branch blood. When the current originates in the SN node and pass through these pathways. This is called sinus rhythm. And if the normal rate is 90 to 100 beats per minute, but if the rate increase from 100 beats per minute, but it is originated from the sinus node and follow the same pathway, it is called sinus bradycardia. In this ECG graph, we can calculate the sinus bradycardia from the previous formula. Here, the big square between the two R waves, if we count them, they are 2. And if we will divide 300 by 2, the rate will come 150 beats per minute, which is more than the normal, and the rhythm is sinus, so it is called sinus tachycardia. Rhythm strip feature of sinus tachycardia. What are characteristics of the sinus tachycardia or ECG graph? Rate will be fast than 100 beats per minute. Rhythm will be regular. Here you can see the interval between R wave is regular or same. P wave normally may merge with T wave at very fast rate. If the heart rate is very fast, so the T and the P wave, they are merged in a case of very fast heart rate. PR interval is 0.122 to 0.20 second. From here to here, this is called the PR interval. From the beginning of the P wave to the beginning of the R wave, this is called PR interval. And in sinus tachycardia, this interval remain normal. QRS complex is also normal. Here Q, these two lambs are R and these two lambs are S. So this complex is also normal, which is in the range of 0.06 to 0.10 second. Supraventricular tachycardia. Supraventricular tachycardia is a dysrhythmia originate at or above the atrioventricular AV node and is defined by a narrow QRS complex less than 120 millisecond, and the rate is more than 100 beats per minute. Normal QRS complex is 80 to 100 millisecond, and the normal duration of QRS complex is 0.06 to 0.10 second, or 1.5 to 2.5 small boxes are small square. One small square is equal to 0.04 second. In supraventricular tachycardia, there is a narrow QRS complex which is less than 1.5 to 2.5 small square, and there is no P wave. It is often used synonymously with AV nodal re-entry tachycardia. ECG characteristics include a narrow QRS complex, regular tachycardia with a rate of approximately 180 to 220 beats per minute, and P wave are not detectable. So these will be the feature of supraventricular tachycardia on ECG strip. The QRS complex will be narrow, the rate will be more than 100 beats, there will be no P wave, and the rate may be up to 180 to 220 beats per minute. Now, Atrioventricular Re-entry Tachycardia. What is Atrioventricular Re-entry Tachycardia? In this pathway, you can see that the impulses are generated in the SN node, pass to the AV node, then to the bundle of Hess and right bundle branch and left bundle branch. But in this type of tachycardia, re-entry tachycardia, what happens that there is re-entry of the same wave to the AV node from the ventricle to the atria on the same pathway, retrograde entry. This retrograde entry may be orthodromic or antidromic. Antidromic means when they enter on the same pathway. This pathway is one way, but these impulses enter on this one way pathway in antidromic situation to the SA node and stimulate the SA node. Stimulation of SA node is by two means, from the SA node and from the re-entering retrograde waves from the ventricle. By double stimulation of the AV node, the heart rate become increased, and this is called supraventricular tachycardia. In this condition, the extra impulses generate from the AV node are near to the AV node, not from the SA node. There is an accessory pathway. Atrioventricular Re-entry Tachycardia is a form of paroxysmal supraventricular tachycardia that occur in patients with accessory pathway, usually due to formation of re-entering circuit between the AV node and the accessory node. ECG feature depend on the direction of conduction, which can be orthodromic or anti-orthodromic. We know that in supraventricular tachycardia, you can face 5 types of ECG patterns. In type 1, as we know that in supraventricular tachycardia, QRS complex is narrow. There is no P wave and the rate is more than 100 beats per minute. So here you can see the rate is more than 100 beats per minute. There is no P wave and QRS complex is narrow. This is one type of supraventricular tachycardia. The second type is the absence of normal P wave, typically defined supraventricular tachycardia. Retrograde P wave, which can create pseudo R wave in V1 and pseudo S in inferior lead secondary to the retrograde P wave. Here again the heart rate is more than 300 per beat per minute. QRS complex is narrow, no P wave. But additionally, if we will go to the V1, there is a retrograde P wave in V1 and pseudo S in the lead tree. Here you can see that V1 there is QRS and T complex, there is no other wave, but here you can see that in here is an extra wave before the T. This is called pseudo P wave or retrograde P wave, which is present in supraventricular tachycardia. The third type of ECG, which you can see in the supraventricular tachycardia, here again is no P wave, narrow QRS complex and heart rate more than 100 beats per minute. Elevation of ST segment in AVR and depression of ST segment in chest lead V5 and V6. If you see such ECG pattern, so first bring the rhythm to normal. When the rhythm is become normalized and still these changes, the ST elevation in AVR and ST depression in V4, V6, which is found in inferior MI is still present, then you can treat the patient is an MI, but first bring the rhythm to the normal. Supraventricular bundle branch block or accessory pathway. This is the fourth type of ECG which you can see in supraventricular tachycardia. Here you can see that there is no P wave. Here the QRS complexes are broad, found in bundle branch block. It is very difficult to tell the difference between a wide complex SVT and ventricular tachycardia. It is usually safe to assume that the wide QRS complex is ventricular tachycardia and treat it as such. If you see this type of ECG in which wide QRS complexes are present and you suspect that it is bundle branch block, so first bring the rhythm to the normal and then after that treat the bundle branch block. Supraventricular tachycardia may cause a pseudo-electrical supraventricular tachycardia may cause a pseudo-electrical alternance pattern. Pseudo-electrical alternance pattern has been reported in supraventricular tachycardia. This would look much like the ECG seen in cardiac tamponade with alternating voltage. The overall voltage of the pseudo-electrical alternance is relatively normal in supraventricular tachycardia as opposed to true tamponade. Of course, if ever see this pattern, do an echo and look for effusion. This is a fifth type of ECG which you can see in supraventricular tachycardia. Here, when you will again, there is no P wave, QRS complex is narrow and the heart rate is more than 300, but the amplitude of the R complexes are, in some complexes they are more and in some complexes they are less. This pattern also occur in cardiac tamponade or pericardial effusion. So first confirm the pericardial effusion and after that treat the patient as a supraventricular tachycardia. Atrial fibrillation. Atrial fibrillation is the most common cardiac arrhythmia. It is characterized by discharge, atrial electrical activity and contraction. The pulse is irregularly irregular, meaning that the pulse does not repeat in any discernible way. On electrocardiogram, atrial fibrillation is the absence of distinct P wave. This is the ECG of atrial fibrillation. In atrial fibrillation, the rhythm is irregularly irregular or the pulse is irregularly irregular. Here you can see there are two pulses. Here you can see there are three and there is a gap. The P waves are not prominent and here you can see the impulses and contraction of the atria is discoordinated or is disorganized. There is no organized pattern of discharge and contraction of the atria. That's why the P waves are not appearing on the ECG strip prominently or normally visible. They appear in disorganized manner on the ECG paper. Atrial flutter. Atrial flutter occurs when a reentrant circuit is present. causing a repeated loop of electrical activity to depolarize the atrium at a rate of about 250 to 350 beats per minute. The atrial rate in atrial fibrillation is 400 to 600. As we know that there is delay in the AV node, so the atrial rate is 400 to 600 and the ventricular rate is low than the atrial rate. This produces a characteristic sawtooth pattern of the P waves different from the atrial fibrillation, in which the atrial rate is so fast that a P wave are not identifiable, or only coarse fibrillary waves are present. In atrial fibrillation, the waves are not and only fibrillary waves are present, while in flutter, the P waves are sawtooth-like. These are the P waves which are sawtooth-like. This is the example and clear picture of the sawtooth wave which occur on the ECG paper. These are the sawtooth, and here you can see these are the P waves which occur in sawtooth pattern on the ECG paper. Type of bradycardia include sinus bradycardia. When a person has sinus bradycardia, the heart rate is less than 60 beats per minute, as we have discussed already. Sinus pause, also called sinus arrest. Sixth sinus syndrome. Tachy-brady syndrome, which is also called tachycardia, bradycardia syndrome. Sinus bradycardia. Sinus bradycardia occur on an ECG when there is normal upright P wave in lead to sinus P wave preceding every QRS complex with a ventricular rate of less than 60 beats per minute. In this case, the P wave is clearly visible and it is followed by the QRS complex, but the rate is less than 60 beats per minute. If we will count the big squares between the two R waves, these are 1, 2, 3, 4, 5 and 6. If we will divide 300 by 6, the rate will come to 50. So this is called sinus bradycardia because P wave is present and the impulses are generated in the sinus node. Causes are AV block medicine, those drugs which are used for the atrioventricular node blocking. These are beta blocker, calcium channel blocker and digoxin. 6. Sinus syndrome. Hypothyroidism, hypothermia, obstructive sleep apnea, hypoglycemia. In hypoglycemia there is bradycardia. Sinus pause, also called sinus arrest. During sinus pause, the heart may miss one or more beats because its natural pacemaker failed to activate the electrical system throughout the rest of the heart. Depending on the cause, there is a risk of complication with this type of bradycardia. Here in this case you can see that there is P wave QRS complex, P wave QRS complex, but when in sinus pause or sinus arrest, the P wave is dropped. There is no P wave or no generation of impulses from the SA node, and the QRS complex is formed. There is no P wave. This type of appearance on ECG is called sinus arrest or sinus pause. 6. Sinus syndrome. 6. Sinus syndrome happens when the normal pacemaker of the heart the sinus node does not work properly. In sick sinus syndrome, sinus arrest can lead to the disappearance of sinus P wave accompanied by a variety of escape and escape rhythm. Here you can see this is the normal rhythm, P wave QRS complex, P wave QRS complex. But here the P wave is drop. There is no P wave and QRS complex appear on ECG. So this phenomena run for many beats. This pattern is called sick sinus syndrome. Here there is no P wave. Again the P wave is dropped and the QRS complex is present. So this, when there are multiple drops of P waves after normal rhythm, this is called sick sinus syndrome. Tachy-bradycardia. In tachy-bradycardia, also called tachycardia, bradycardia syndrome, the heart sometimes beats too quickly, tachy, and sometimes beats too slowly, brady. This abnormal heart rhythm problem is often seen in people who have been diagnosed with atrial fibrillation. It can occur when the heart natural pacemaker is damaged. Here you can see that here the heart rate is 150 per minute in this condition. Then the heart rate becomes slow down and it is 1, 2, 3, 4, 5, 6. So it is 50 per minute. In tachy-bradycardia, for some time there is increased heart rate and for some time there is decreased heart rate. Thank you. Please subscribe the channel and down the bell icon for recent update.